Pain in your tendons, tendinitis, stress a tendon, it rebuilds. Stress a tendon, it rebuilds. Stress a tendon, it partially rebuilds. Stress a tendon, it doesn't rebuild. Tendinitis, tendinopathy. Houston, we have a problem. But do we have a solution? I'm Dr. Adam Fields. I'm a chiropractor. I use the Piezowave to send focused shockwaves into your tendons to help them. Everything from Achilles tendinitis, rotator cuff tendinitis, golfer's elbow, tennis elbow, even peroneal tendinitis on the side of the ankle.
A while back, I was chasing after my kids downstairs and I sprained my ankle and had no idea how bad it was going to be. Thought it would heal up, like the doctor said, in 6-8 weeks. They put me in a boot, and after I got that boot off, it just was not healing. And I let it go for a couple years, and every morning waking up with just pings shooting through my foot. It was achy at the end of the day, like it just hurt. I didn't feel like I could chase after my kids freely. I was fearful of going downstairs or going for a jog. And I just was in chronic pain.
Tendinitis can result from an acute injury or a repetitive stress injury. Either way, you're exceeding the low tolerance levels of the tendon.
So yeah, it turned into chronic tendinitis, and I was chatting with a stranger actually about my ankle, and she's like, I had a bad ankle too, and I went and saw Adam Fields. She gave me your number, and I came in pretty soon after that and probably did about 6 to 8 sessions with the Piezowave, and which was a little brutal, but it cleaned up my ankle, and I don't have those stinging, shooting pains in my ankle. It doesn't ache anymore, and it feels normal.
When your tendons are trying to inappropriately heal themselves, it isn't a complete healing or a complete adaptation. We're calling it tendinitis, but the reality is it's more like tendinopathy or tendinosis. Tendinitis would imply inflammation. Really, it's not an acute inflammation thing. It's more like chronic adhesions, tissue failure, tissue rot even. The tissue needs to be healthier. It's not just inflamed. So what do we do with this? Do we do a corticosteroid injection? Cortisol, the natural form of cortisone, is a stress hormone. If there's a lion in the room, if there's something very stressful going on, your body says, I might be without food, I might be bleeding. So in that case, I'm going to send cortisol out to break tissue down, convert it into glucose, so I have free-floating glucose in my body so the brain can stay alive in a gnarly situation. So really what it's doing, it actually weakens tendons, it weakens cartilage, it weakens bone. With bone, it's going to stimulate osteoclastic activity or the cells that eat the bone, and it's going to inhibit or kill osteoblasts, which is the things that create bone. With cartilage, it causes what's called chondrocyte apoptosis, which is death of chondrocytes, literally killing the cells that make healthy collagen. So is there an alternative?
So with the Piezowave, it's a really intense, deep, stinging pain that you feel when they're getting on the spot that needs healing. And if it was too intense, Adam's assistant would lower the strength, but it's working when it's feeling pretty painful. And then if they do it enough in the same spot, it actually starts to lessen in pain because it's breaking up all that scar tissue. And so you could feel it working in each session. In every session, you felt less and less pain because there's less and less scar tissue.
The Piezowave emits low-energy, focused shockwaves that go into your tendon. It's kind of like a deep massage on a cellular level that breaks up adhesions or scar tissue. Then it brings neovascularization or new blood supply to the area, and then chondrocytes are actually stimulated. So it goes to repair with new collagen your tendon.
Yeah, so that sprained ankle happened about 4 years ago, and I'm still pain-free.
Yes, I'm talking about regeneration, and yes, this is lowering your pain levels, and there is great research on it. Check this research out on neovascularization. Shockwave therapy induces neovascularization at tendon-bone junction, a study in rabbits. Thank you, rabbits. Shockwave therapy induces the ingrowth of neovascularization associated with early release of angiogenesis-related markers at the Achilles tendon bone junction in rabbits. Those guys use their Achilles tendon, that's for sure. The neovascularization may play a role to improve blood supply and tissue regeneration at the tendon-bone junction. Can cortisone do that? Nope. How about patellar tendinopathy? ESWT seems to be a safe and promising treatment for patellar tendinopathy without positive effect on pain and function. Dancing again might be in your future. Extracorporeal shockwave therapy for chronic patellar tendinopathy. Check this out. At a 2 to 3 year follow-up, you had one group with physical therapy, exercises, at-home care, anti-inflammatory drugs, and a knee strap. The other group had extracorporeal shockwave therapy. Check this out, a 2 to 3 year follow-up. This is a very good study. Show that 45% of the shockwave group were excellent. 0% of the PT exercise group were excellent. 47% were good in the shockwave group. That means over 90% of the shockwave group were good or excellent. The PT group, 50% were good, 25% were fair, and 25% were poor. And they conclude, extracorporeal shockwave therapy appeared to be more effective and safer than traditional conservative treatments in the management of patients with chronic patellar tendinopathy. Imagine doing both. All the rehab exercises with the extracorporeal shockwave therapy. What a combination. Check this out. ESWT may be utilized safely for in-season athletes. So the Piezowave can be used right in the middle of the season. I mean, you can't say that about a surgery, for instance. You can use it before a workout, during the season, no problem. So give me your tired, give me your poor, give me your huddled masses, give me those yearning to be free, give me your tendons, and let's get them free again.